A pleasant good afternoon to everyone again. Welcome back to the Korean Entrepreneurship Program here at the Antigua Public Library. Today we have with us Mr. Dave Bridgewater, who is a pharmacist, and he will be telling us about himself and his profession. Good day, Mr. Bridgewater.
Yes, good day to you and your listening or viewing audience. Yes, so
So,
your show.
please tell us about yourself, Mr. Bridgewater, and what it is that you do.
All right. So I am actually the pharmacy manager, chief pharmacist at Mount St. John Medical Center.
Mm.
I've been in this position from about 1997, actually. I have been a pharmacist since 1994. My education with respect to pharmacy has been achieved first as a pharmacist student at the Harvard Hospital for 3 years, where there was a certificate program. After that, I proceeded to Jamaica, where I did a diploma in pharmacy for 3 years. After that, again, I went back to Jamaica, where I pursued a bachelor's of pharmacy degree for another 3 years, and currently pursuing my doctorate in pharmacy, which I should complete 2001. So that's my education, and my position has been pharmacy manager since 1997, Alberton Hospital, and now Mount St. John. With respect to pharmacy practice, I've actually practiced in the private public sector, community pharmacist, that is, for a while. Still do some part time in that particular role, but mainly I'm here at Mount St. John, where I'm more or less responsible for the clinical aspect of pharmacy.
Wow, that's a long and illustrious career with a lot of studying. Did you always know that you wanted to be a pharmacist? Was this your first option?
That was my grandfather's option. He's the one that said, even when I was in high school, to myself and my aunt, that one day I will be a dispenser. At that point, I was in first form. I was wondering, what is he speaking about? A dispenser? What is that? Actually had no clue. I was more into the arts and music because my father is a musician, and I always thought that one day that I too would want to be a professional musician, and also wanted to be a journalist. But my grandfather, for some reason, figured that I would be a dispenser. And so at the completion of high school, I was in secondary school, to be exact, for 1 year out, I actually tried to get a job as a journalist, and I wasn't successful at that at all. So for the whole year, I was trying. And then one day I got a call from the hospital because my aunt had actually said to me there were vacancy for pharmacists, dispensers at Harborton Hospital. I had no clue. So I, just like anybody else, well, I needed a job, so I just sent it. And then it dawned on me, but this is what my grandfather wanted. The good thing about it, though, having decided to try my way, I was accepted, and I actually figured that, this was just something that I would just pass time with. But having gotten into it and realizing that I was dealing directly with individuals, sick individuals at that, I realized that this really and truly probably might be my calling. And so I'm here from since then up to now. And the reason why I'm still here because I do believe that I am serving a purpose.
Well, we're very happy to have you. I mean, a lot of persons, who would have gone into a particular field, usually they say they go because they felt so called. It's interesting that this is something that you would have stumbled into and that, this became the thing that you wanted. I mean, it means therefore you would have had an excellent family support. I can imagine how happy everybody was when you finally did the thing that
Sure,
was
they were.
expected of you.
Yes, he said, I told you so because really he asked me shortly after when I first achieved my certificate, what were my thoughts about this? By then, I was actually hooked. What is it? Hook, line, and sinker. Right. That
Mm,
was me because of my mom. And she's a very caring person. My father too. And I actually learned that doing pharmacy, where it was that I was going to be helping persons, especially sick persons who could not do things for themselves. I realized that, hey, this was a natural tendency, something that I inherited, and why not? Didn't pay the
mm,
type of money that would, probably attract a young person at the time. But over the years, it has actually grown to be something that allows good remuneration when
mm,
you compare to what is happening out there.
mhm. Wow. I'm going to ask a question, and it might sound a little bit strange, but what does a pharmacist do exactly? What does your job entail? What do you do on a day-to-day basis?
All right. So there are different types of pharmacy practice and different categories of the pharmacy profession. Starting
Mm,
basically with being a pharmacist, but there are different little niches that one may have. And one of the niche and that's one of the reasons why I stuck around hospital pharmacy is
mm,
clinical pharmacy practice. This is where
mm,
you have almost a direct interaction with the patient, the doctors, and the other members of the nursing team. Unlike in the private sector where it is just you and the patient and more or less calling the doctor if there's an issue, is a direct
mm,
hands-on. And so at the hospital, for example, where I'm the manager, we have pharmacists who are responsible for the outpatient section, where it is that they're filling scripts and counseling patients, advising them as to how to use their medication properly, ensure that the therapy that they have been prescribed is the most suitable in terms of um, efficacy, safety, and to ensure that they are complying with the medication. Because one thing that we know in Antigua, we have a culture of feeling sick today, getting medication today, and as a result of feeling better by tomorrow, all the medication going through the window or in our storage to be given to our friends or family member when they present with symptoms similar to what we had. And so our
mm,
goal here really is to be the vanguard for these patients to whom the doctors would have written a prescription for. A pharmacist does have our duty of care to these patients because we are licensed to so perform our duties. And as a
mm,
result of that, we have to ensure that, as I indicated to you, not only that the medication is efficacious, but the medication is safe. And safety is not just about taking the medication safely, but storing the medication. So on a daily basis, we are monitoring what is happening in the hospital with respect to all the medications on the floor, meaning the ward, and the
mm,
medication that leaves the hospital. So we have to ensure that at the end of the day, that the patient is comfortable with the medication, and we also would have put things in place to monitor that the patients uh, even have a channel to communicate back to you if there's any untoward effect, be it adverse effect or any issues that they're having. So that is our role. Our role is the drug role, and when I say drug role, the legal drug role, to ensure that we are there to give the patient any information that they so require. We also supply information to the other healthcare professionals. That is our main role in the hospital in the event that there's any questions to be asked, ultimately concerning a drug, its effect, its dose, what is drug interaction, be it that, can we take these two drugs together, drug food or
mm,
drug app? We are the persons who are responsible to answer that question ultimately. So,
mm. Wow, that sounds like a lot. I suppose as many persons, we just assume that, all the pharmacist really does is just stand behind the counter. You give them your prescription or you tell them what it is you're looking for and they give it to you and that's it. But clearly there's a lot of thought and preparation and diligence that is required to be a pharmacist. What would you say is your most favorite part of your job?
the most favorite part is actually dealing one on one with the patient itself, having receive the patient's script and ensuring that everything on that script is correct. And when I say correct, that the patient is getting the right dose, the right time, the right route of administration, meaning by whether it's be by mouth or whatever the route that you're going to administer this medication, to ensure that there is no interaction, having satisfied myself that all is well. Um, the favorite part is now speaking with the patient and ensuring that they understand exactly how they should be taking this medication, and strive as much as possible to be a part of the compliance program. As I indicated to you first, that quite often, having done all that work, then we have our patients not taking the medication for the period of time. And I should mention at this time, typical example, you have heard of this antibiotic resistance issue. We're going to just use that as an example. Um,
Mm-hmm.
the issue is, if we're dealing with one patient, we have to see that patient as a whole. A patient is a part of the community, and their action, what they actually do with a drug, can have an impact on other persons too. Because if they're not taking their antibiotics right, for example, it means that somebody else may inherit that immunity that may have developed because of the same strain and how they would have transferred.
Oh.
And when you speak about community non-communicable disease, which is a big issue in Antigua today, our hypertension and diabetes, these have indirect impact on the society also, and our limited purse. We are limited resource setting. And so if we can get our patients to fully understand the implications of taking your medication correctly, and the fact that our family members, our neighbors, or the person in the society will have to make some intervention if, for example, we're using our medication, it's not working well. Some other interventions are going to have to take place. So I enjoy ensuring that the patient is comfortable with the information or advice that would have been given, and opening a channel for them to always come back and say, this is the situation. Follow up is always important.
That's true. Follow-up is always important. As a person who occasionally has to take medication, I can tell you one of the hardest parts is remembering to take it. Because as soon as you start feeling better, you start to lapse on taking it on time. Even if you remember to take it, it might be later than it should be. And it's something I think that is quite common for a lot of people. Because before, when you're sick and you're feeling it, you're watching the clock for your next dose. But as soon as you feel a little bit better, it starts to slip your mind pretty
Very
easily.
commonplace. About 7 out of every 10 patients has that particular tendency. Right.
Right. So, what would you say now is your least favorite part of your job?
Not being able to satisfy the requirement that's on a prescription. And when I say that, a patient comes to you and you have only maybe 2 out of the 3 medication that they're requiring. And
Mm,
because of, habit also, you fill 2 and you're not too sure if you're going to get a third one. And that third one
mm,
might very well be the one that, encourages the synergism between the different medications. So the patient takes 2, you don't have the third one to give, and you're not too sure how they're going to actually get it. So they would have left you, and you're wondering to yourself, what's going to be the outcome? What is going to be
mm,
the outcome? Right. And that is the part that is sometimes saddening, because, especially now during COVID time, and the purse is not what it used to be. You're not too
mm,
sure sometimes if the patients are actually getting not the correct, but what was actually prescribed in its entirety. That is the sad part. And so,
mm.
um, yeah, I just figured that, if your patient is going to be complete in terms of your treatment, and I can deliver everything that the patient requires, then I am happy.
Mhm. For those who may be considering a pathway in pharmacology, what subjects would you suggest that they study? What subjects do you think that they should have an affinity for if this is what they're planning to do?
Well, as I said, there are different niches, yes. And you just mentioned pharmacology. We actually discussed in pharmacy. Person down
Oh,
the road.
pharmacy, sorry. Pharmacology is the
Right. So
formulation of the medication,
pharmacology,
right?
right. So that is one aspect of pharmacy, the pharmacology. But
Mhm,
pharmacy in itself,
mhm,
in Antigua, there's actually a program here at the State College.
mhm,
It's a 3-year program. It's a associate's degree program. And the requirement for entry into that program is very much similar to the medical school requirement, which would be your chemistry, your physics, biology, math, and English. Those are the 5 basic subjects that you would need. And the application is through the state college. There are also
mhm,
technician programs. We actually have quite a few pharmacy technicians who would have started having done their technician course through Ashworth and as one of the main universities, and having been introduced to pharmacy via the technician route, would have
mhm,
decided to change and upgrade their profession to pharmacy. We also have quite a few persons in pharmacy today who are teachers. They used to be teachers and have decided that, they want to do something different and has migrated or transferred
mhm,
over into pharmacy. Right. So it is
mhm,
very easy. Get your CXC subjects going. As I indicated, your English, your maths, your chemistry, your physics, and your biology. Send your application.
okay. What does a pharmacy technician do?
All right. So the pharmacy technician assists
Mhm,
especially with the counting, with the storage of the medication, even help with advising the patient as to the instructions that would have been given by the doctor, probably written by the pharmacist, but brings
mhm,
clarity to it in the event that the pharmacist is so burdened. You know already, sometimes in the workforce, the human resource is limited. You can't hire
mhm,
enough pharmacists. You have technicians, and so the technicians is working closely with the pharmacist. The pharmacist has to ensure that the prescription is correct and everything that the technician is going to the window is certified. And so that is actually the role of the technician, right? To carry out the instruction and the advice that would have been given by the pharmacist.
okay. If you could give yourself, your past self, one piece of advice as it pertains to your present career, what would it be?
One piece of advice
Mhm,
with respect to my education.
mhm,
When I started out basically having those subjects that I said to you, and decided that Antigua had a pharmacy program was easy to get into.
mhm,
Having gotten into it, um, I could have become very comfortable, and I did become comfortable because I was in that position for about say 2 3 years, because I'm a musician also. Now, when you're qualified in a particular field, it's very easy for you to just go to the radius of going to work every day. But you realize that the information that is there and coming at you and persons requiring you to be proficient at at your craft, that just at the basic minimum, let's use those 2 words together, basic minimum qualification. I figured that I should have gone much earlier because I don't think that I would have satisfied um, the 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 expectations of the patients who I served at that particular point. I think I stayed a little bit too long, 3 years, and 3 years with a certificate um, is not good enough for a profession like this. This is a profession that requires you to be qualified. And I'm saying that we can become very comfortable, especially in Antigua, where you're allowed to wear 1 2 3 hats sometimes, and you just satisfy yourself. I'm qualified in this. I have another job over here, and then you become jack of all trades and master of none. So my regret is that early o'clock I should have strived to in my younger years to 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 become a little bit more qualified, such that I could have delivered the service that I should have been able to deliver at that time.
mhm. I hear you say that you're a musician. Mind telling us what instrument you play?
I play the keyboards as my main. instrument. I do play that. I have to say professionally because I'm paid to do that, and it is most most times someone asks my profession. I am a musician, pharmacist, or pharmacist musician. I actually get paid for doing this. I do this practically 3 to 4 nights per week on average, and it does supplement not only the pocket, but mentally. I'm able to do something that I like and relax in the moment of doing it. And so music is something that is complementary. And looking around Antigua, quite a lot of the persons in the medical field are musically involved in some in arts. You know, you have a lot of singers, musicians. I can call a few: Dr. George Roberts, Dr. Lester Simon, and we all end up playing in like star band, for example, together. Right. So music is something good and complementary to practically anything and everything that you do.
True, very true. So how long have you been playing music?
I want to almost tell you all my life, only because my father is a musician. So from the age of let's say around 3, I can recall him putting me on the keyboards, and he was the band leader for a band at the time, Saints Brothers. So he exposed me to all instruments in the band, and so I've been around music. It was a hard decision when I finished school whether I wanted to just stick as a musician or become a professional in something else. So music it is, music and pharmacy.
Did you pursue any certification in music?
Yes, well, my father had at that point sent me to music school um, up to grade 3, 4, up to grade 4, music, theory and practical. I was able to qualify myself in that. But then, being that I was trying to follow in his footsteps, playing music in bands and in the church, I did not go to college or university to do that. But what I did was to try to develop my ear and play with musicians that made themselves available to me. And that is how I developed my proficiency in terms of the music. So, not necessarily certified in school, but I have my grades to show.
Okay. Is it something that was you found difficult going to music school? Is it something that you would recommend to anybody who is looking for perhaps like a secondary skill to pick up? Because I know that music has powers to soothe the savage beast. So I can imagine that playing, as you would have said, is relaxing. But, a lot of people may feel intimidated, by the aspects. They look at international players and they're like, well, I'll never be that good. What do you say to those persons who think, this might be a thing they want to try, but they're not sure?
Well, that's the thing about it is music, has so many different branches, so many different things that you can do. And unlike in the day when I would have started, today going to music school, especially at the tertiary level, expose you to so many different aspects of the music. Could be the mixing of the music, could be programming, it could be taking up an instrument, it could be just a theoretical part, it could be magic. There's so many things in music that can be done. And I believe what is really needed from you would have, made the first step, having an inkling to do something. And then you realize so many different things I could do in music. I could make money doing so many different things. And that is a career path that I would always encourage young persons to follow. And I say young persons because, a lot of persons turning out from school now. And you really wonder, where am I going to go? Trust me. You might not be involved in pharmacy, maybe because your grades were not there. You don't have requirement. You don't need any grades for music. You just first need a liking, and the sky is the limit after that. The sky is the limit after that. So pursue music. Try something. Maybe naturally. Try your singing talent. So I would advise music.
Okay. Apart from the guitar, what other instruments do you play? Oh,
As I said,
sorry. I think you said you play piano.
yeah, my main instrument is actually the piano. I would not
Mhm.
boastfully tell anybody that I play the guitar and the bass. I do these things in the background. Having been exposed by my father, as I said, to practically a
Mhm.
lot of wind instruments and string instruments. I do play those things, but uh, I don't go around telling people I do it. Maybe if I'm in the studio, I do something for myself. Yeah, right. But my favorite instrument is the keyboard.
Well, Mr. Bridgewater, we're running out of time, so I just want to say thank you very much for coming and speaking to us today. I'm sure that our audience was very well informed and they're happy to have a face to put to the name that they may have heard from time to time, and also to see that pharmacists are persons who are open and that we can ask you questions and be comfortable. And we're very grateful to have persons like you working in the background and assisting us.
Anytime I'm available. Thank
All
you
right,
for
everybody. Oh, sorry about that. All right, everybody. We'd like to thank you all for participating in this series with us. This is our last show, and we were so happy to have Mr. Bridgewater with us. Look forward to other things coming to you live from the National Public Library's Facebook page. It's been a pleasure. Miss Thomas signing off. Bye bye.
Bye.